I've been working at Makerere University School of Public Health since 1995, which is close to 30 years. I came as a young man, as a young researcher in 95, and then started on my master's training in 96. And this was a small class of 12 people. Sadly, 3 have parted. So our cohort of 96 will remain only 9. But we used to sit and study in one small tutorial room of accommodating 12 people. So infrastructure then was not such a challenge because of the numbers. We were few. We only had one program. We had the MPH program, which had just started in 1994.
When I became the dean, we had very few academic programs. We had few staff and very few projects. But even those few were not fitting in the building that you see at the School of Public Health. That's the only building that was there for the school, and we needed to expand.
When I was a student in the School of Public Health more than 20 years ago, the school had about 40 students in just one master's program, the Master of Public Health program, in addition to supporting the training for medical students. But today we have about 1,000 students.
And we have had a huge impact in increasing the human resource, both the quantity and the quality of human resource in Uganda. We have had amazing numbers, unfortunately, of epidemics. The School of Public Health plays a very significant role in managing this epidemic.
The training in this place calls for quite a rigorous engagement between the faculty and the students. But then if we are limited by the space of laboratories, if one cohort is doing, the other cannot be in position to engage and have their work in place.
Having constructed the School of Public Health back in Mulago in the 60s or 70s, and up to now it's still standing, we have given the best quality on this job, with experienced project managers, experienced engineers, and experienced team that has worked on all the projects around town under local construction.
I'm satisfied with what we've done so far. I have a good team of contractors. I have a strong team of consultants that have been with me, sleepless nights, telephone calls at odd hours, just to make sure that we come out with a product that's pleasing to our client and to society at large.
So welcome our stakeholders to the event for us to celebrate and launch the first phase of the construction of the School of Public Health, starting with the auditorium, which is now ready for us to use.
Makerere University School of Public Health, fondly known as MakSPH, is the leading public health training and research institution in Uganda and Sub-Saharan Africa. It is one of the schools under the College of Health Sciences, a constituent college of Makerere University.
The School of Public Health has a long journey and a long history, more than 65 years, when we started as a department of preventive medicine under the Faculty of Medicine then. And we grew into an institute over the years, the first Institute of Public Health in Sub-Saharan Africa, and eventually gradually grew into a School of Public Health in 2007 before Makerere moved into the collegiate system. So this was an independent institute and eventually an independent school. And then eventually the school joined other schools and into the College of Health Sciences. A big part of our history is that the School of Public Health started as servicing support for the region as well in some of the specialized areas like biostatistics, and some of our teachers and mentors who have since retired were actually part of that effort to support and grow biostatistics to improve generation of evidence and use evidence in decision making. And then we had Kasangati, which was a training center where many of us went when we were medical students. So the School of Public Health started off as a regional support for growth of public health and has made a tremendous contribution to growth of public health in Africa and the region.
Beyond teaching and learning, we conduct research and provide technical and expert services to the Government of Uganda, Ministry of Health, various national and international health organizations, as well as bilateral and multilateral agencies involved in health.
In fact, we support NEMA, NEMA, which is the National Environmental Authority. We support the Ministry of Water and Transport in this area, as well as the Ministry of Health for NCDs. So we are well positioned.
MakSPH currently supports several training, research and service projects across Africa and serves as a hub for public health programs within the region.
When West Africa had the Ebola epidemic, a lot of our students or past students actually went to participate in managing those epidemics. But the impact, the regional African impact, was great.
Many of them were our graduates. In fact, our school was contacted to generate a list of people that we are going to support through the AFENET, the Africa Field Epidemiology Network, to support the response in West Africa. We have similarly also sent them to support disease outbreaks within the Democratic Republic of Congo. When you get to the COVID response, it's the same thing. We had many of our graduates, including students who had just left, that were sent through WHO support and the AFENET again to support the Ministry of Health. So in terms of workforce, it's huge. And we also do have very strong partnerships with many of the key players in public health.
Our major research and capacity building areas include, but are not limited to, infectious and non-infectious diseases, sexual, reproductive, maternal and child health, environmental and sustainable health.
We have had several schools in Africa, schools of public health. But what do they represent? They represent the health of the nation. When you talk of COVID, you talk of non-communicable diseases, all these are public health. You need a school that will have as many programs as possible to teach and skill people that handle the communities.
Over the past 20 years, MakSPH has expanded from 1 to 9 academic programs, an undergraduate program, 9 master's programs, and a PhD in public health. The number of trainees has also grown from 40 to over 1,000 and is still growing.
Makerere School of Public Health is a knowledge hub for public health evidence in Uganda, and I will say that a huge contributor to knowledge in the region as well in Africa and at the global level. When we look at workforce development, when we did the last tracking study, for example, for the thousands of students that have gone through the Master of Public Health program, perhaps close to 60% of people working in the districts, the district health officers, are graduates of Makerere School of Public Health. When you get to the Ministry of Health, again, it's the same thing. You're going to find a very significant number, probably also close to half, of people that have done Master of Public Health training have gone through Makerere School of Public Health. And many of our graduates are also working in the region. The future of public health workforce in Africa is one that we are a very central part of. In fact, at this point, we are actually working on a review systematically of the workforce needs for Africa and what it needs to look like for the next generation, especially looking at the experiences coming out of COVID. That is something we hope we'll move forward quickly and we'll be able to add to the strategic direction for the Africa Centers for Disease Control and other players within the region to enhance workforce.
However, there hasn't been a corresponding rise in training and research space, and for years, MakSPH has been constrained by limited space to accommodate its students, staff, and research programs. In fact, over $100,000 is spent annually by the school on renting office space. Hence, rent and space remain our biggest constraints in pursuit of our mission.
In terms of teaching, space has actually been one of our biggest constraints because we now have cross-cutting courses in statistics, in epidemiology, where we bring back together students across all the programs. And when we pull them together in some of these cross-cutting courses, there are more than 200 students. And the classes we have right now were constructed for about 20 students. So we've had to look up for space and we've tried to expand, but still this is not good enough. When we are doing exams, sometimes with cross-cutting exams, we have to use like 5 different spaces at a go to be able to do exams in statistics or epidemiology. When we hold seminars, we can hardly accommodate enough people. Of course, we've gone online now so that we can open up our work to the broader world, but still we don't have sufficient space to accommodate those that are with us. So I would say space is one of the biggest constraints to our growth, and it's also making our operations inefficient in terms of spending so much money in rental space. Right now we are renting space. In Kololo it's very expensive, so we need to be able to fix that for sustainability. We hold conferences because with our partnerships we do a lot of joint conferences where we bring in visitors from other countries, those partners that we're working with. It's expensive when we have to hire that space for conferences in hotels. So very close to space, once it's done for us, is to also find money to equip the space with good technology laboratories for us to be able to improve our teaching and our research.
In response to this challenge, MakSPH embarked on a project in 2019 aimed at constructing a new facility at the main campus. This facility will serve as a dedicated space for teaching and learning for learners, research fellows, doctoral students, and postdoctoral trainees.
The students within the school cannot all be in one place at the same time due to challenges of space and so on. So that means many a times we have to get chairs from here and there, put in the room. We get organized a lot of events like conferences.
I feel if we have quite a lot of space to this new facility that is being put in place, it opens up bigger doors for young people to engage in innovation and put their brains to work to see to it that at the end of the day, public health is put at the forefront and the community at the end benefits from this.
In the next 5 years, I would really hope to pursue my master's, hopefully in epidemiology, and I would be so excited to study that from the new facility put in place.
We've also been having a challenge in the area of space, that we have not been having a good lab space to be able to house for us to do the science that we require to do. And therefore I've been borrowing space among in other colleges, in other universities to be able to do the science. But the new building has come to address the issue of space as far as the science of air quality monitoring and the health aspects is concerned.
Now for the first time in East Africa we'll have an independent, well-built, well-structured, well-planned school with all these labs, so that if you need to check on anything, environmental pollution, if you look at this country, there's no lab that does environmental pollution apart from what we have been doing in the school through a small project, but now we shall have a fully-fledged lab.
The estimated cost for the completion of the fitted building stands at $10 million. As of now, the school has raised $4.8 million with an outstanding deficit of $5.1 million.
We had hoped to complete this in 2 years. Guess what? 2020 shut down. We had a lot of slowdowns. We had a lot of applications for renewal of contract, and the university was generous, and I thank the University Council and the committees that we had to go through.
Building for the future couldn't be more truer than fundraising to build an infrastructure for Makerere, which would outlive all of us and beyond. Money has been raised right from the cleaner, the sweeper, to the professors in the School of Public Health. Everybody has worked towards contributing to this money.
Now, coming to the other phases, do we have the resources? The resources have never been enough.
As pointed out, we still have a deficit, and we look forward to engaging those partners that have given us money before, so we hope that they can see the progress of where we are. We look forward to engaging those potential partners that we are working with. I hope this will entice them or motivate them to be partners in this endeavor. And we do hope that engaging the government will also, through the university, will also bear some results moving forward.
This is the time that partners should see the value of the School of Public Health. I call upon the government to actually give a hand to the School of Public Health, specifically to develop the infrastructure.
The new facilities, combined with our existing infrastructure, will empower MakSPH's to deliver world-class and contemporary training for public health professionals.
I was here in the School of Public Health when we were about 19 students. I think we were 19. We used a very small library which can contain just about 30 students. But now we have 1,000. So just picture that. It's completely not fit for what we have today. So having grown up in the corridors of the School of Public Health professionally, but also come back as a teacher, and I look at the space that we used meant for 30 students, and now I have 1,000, I feel we need to urgently do something about this.
Equipped with the skills to tackle both current, emerging and re-emerging public health challenges, our graduates will be at the forefront of promoting global well-being.
Raising money for the building of the School of Public Health has been one of my biggest challenges as Dean over the last 6 years, because it started right from the time when I came in, and I faced so many challenges trying to find space to fit in people. And I walked around the school and saw how people were seated. So many people in one room, very uncomfortable. I made this one of my major priorities, and I'm excited each day when I see that we are adding a layer and we are getting close to what we aim to achieve for the future generations.
We therefore extend a heartfelt invitation for you to join us as we build for the future.
Of course, 1 + 1 = 2.
Every small contribution is going to reach us to the goal.
I would therefore like to invite you to be part of this journey of building this building for the future, and therefore contribute to the quality and quantity of health professionals, not only in Uganda, but in the region and Africa as a whole.
Together, we can make a lasting impact on the future of public health for Uganda, the region, and beyond.